You ready for some more zoonoses? I know I took up the whole first hour with rabies. That's what you get when you let me talk about rabies. So what I'm going to do is add in the salmonella to this second lecture. So I'm going to try and brush through that one a little bit quicker. And I think you guys are probably more familiar with salmonella. Some of you have probably experienced salmonella yourself. Salmonella enterica is the species that we're dealing with. There are over 2,000 serovars. And the majority of infections in people are foodborne illnesses, similar to Campylobacter, which we'll talk about a little bit later. Salmonella infects any animal with an intestinal tract, right? So if it poops, it's going to be able to get salmonella. And shedding can be continuous or intermittent. Some species are more prone to it. And many of the serovars are host adapted to specific species. So Salmonella Dublin is more common in cattle and very, very rarely causes any clinical signs in cattle, but it'll cause clinical signs in people. Now, cattle who get infected with some of the other serovars of salmonella may develop clinical signs. So there's a lot of variation, there's a lot of host specificity as far as their impact on clinical signs. An important thing to note are some of the more common sources. So water, soil, kitchen hygiene practices are often a factor. And I would add to our kitchen hygiene practices pet food, right? How many recalls have we seen on pet food and pet treats for salmonella? These are not ready to eat, safe packaged products, right? Like I recommend that people treat them like they would raw chicken in their kitchen. So if you're using that on a surface, you want to clean it. If you're washing your dog bowls in the sink, you want to clean your sink before you're putting vegetables in there to rinse. So lots of opportunities for cross-contamination, and don't forget that pet food is not crackers, right? It can survive in frozen meat. It can survive in frozen ice cream, which makes me very sad. And it can survive in fecal slurries on farms or in corners in shelters and practices. Primarily shed in the feces, obviously. Fecal oral is our transmission route. I know it's gross. Hopefully it's accidental, but that's how we that's how we get that. I've seen some really strange things on Facebook, I'm just saying. Like people who are like, I'm eating this to cure my cancer or whatever. Yeah, don't do that. Eggs. Also, eggs are commonly implicated in one of our Enteritidis serovars. Transmission actually occurs through the chicken into the egg instead of externally from the shell coming in. So things we need to be aware of there. Subclinical carriers are common. Animals with absolutely no clinical signs can be carrying and shedding salmonella. We see this a lot in cattle, reptiles, and poultry. Now, you probably don't have a lot of cattle in your shelters, but there's probably an increasing number of you who are rehoming reptiles and are managing backyard chickens that are being neglected or abandoned, or cockfighting cases, and then rehoming some of those. So we see carriage rates of 36 to 90% in reptiles. There's no such thing as a salmonella-free turtle, even though you see them advertised. So when do we see disease? If they're shedding all of the time. Again, if we have non-host adapted serovar, you can develop clinical signs because of that. Or you can develop them when you're stressed, right? Pregnant, lactating, horses after surgery get salmonella. That's why all the vet schools have the salmonella stalls in their equine area. I underlined this because it is so critical. Antibiotic use can precipitate. So you may be treating for another condition. You may be treating a GI condition that's not salmonella. And then salmonella, because the good bacteria are also affected, no longer there to outcompete the salmonella, you can have salmonella overgrowth resulting in clinical signs. So we see this pretty commonly. And sometimes illness can be quite severe, leading to septicemia or death. Doesn't take very many bacteria to make a sick incubation period, usually up to 3 days. It's funny because I do a lot of international travel, and so we're always counting our incubation periods. It's like, I had some guacamole in Ethiopia because they have avocado trees, and they were just amazing, and I couldn't stand not to eat these fresh avocados. And I was like counting the days, like, yes, I made it. It's like food poisoning roulette. So within 3 days, you'll see salmonella developing if you've ingested that. And you're generally sick for up to a week, fever, abdominal pain, sometimes bloody stool. And some people will report that it's a month or more before they really feel back to normal. They're just really drained following that. A low percentage of people who are infected can develop a reactive arthritis. This is sort of an autoimmune response. The salmonella are gone. Antibiotics don't prevent or treat it, but you get this reactive chronic arthritis that can develop from that. So how do we diagnose it? Bacterial culture is going to be our gold standard, and we can do pulse field gel electrophoresis, and that's how we compare isolates from different animals or different people. So we might have something from the dog food and something from the dog, and they match. So we know that that dog food was likely the source for that dog's infection, those kinds of things. And there are PCRs out there as well, and I know some of the diagnostic labs have PCRs on their panel. You want to make sure you know what that PCR is testing for. Some of them are incredibly specific. So it might test only for Salmonella enteritidis, which is the one we're concerned about with poultry and eggs. And if that's the only one you're testing for, you're missing out on a lot of the ones that might be out there. Other PCRs are pretty broadly non-specific, and will pick up 100 or more serovars of Salmonella. So you just need to know what it'll find and what it won't find so that you can interpret those results a little bit better. There's a lot of variation from lab to lab on the quality and the validation work that's done on those tests. Risk factors for animals or for people: age extremes, so the young and the old, immunocompromised, altered gastric pH, so people who are on antacids or are otherwise suppressing acid production, same with animals if we're using those types of medications in them. Anything that alters the GI flora, especially antibiotic use, and opiates also. So if you're using those for pain control or for pre-meds and anesthesia, that slows GI motility, allows the salmonella to adhere and start to replicate, and that can also be a precursor to an infection, a risk factor. Cleaning and disinfection. So this survives and replicates in damp conditions for months to years. So it doesn't have to have the animal to replicate. It does just fine on its own. And again, it can survive freezing. The other thing we need to know about Salmonella is that it forms biofilms. So the bacteria all get together, have a party, and they create this like slimy layer that protects them from all of your disinfectants. You can sit bleach on it for 2 hours and it won't touch it. So biofilms are something that you need to physically scrub. And there are products out there that are made to help with biofilms, but typically really good thorough cleaning and scrubbing is going to be useful. If they don't have the biofilm, typical disinfectants are effective. But just wanted to highlight that thorough cleaning, mechanical removal are really important, as well as drying. So you don't want to keep your conditions wet all the time, because that will help facilitate salmonella growth. And they can hang out in little cracks and crevices and things like that. So when they talk about cleanable surfaces, this is one of the reasons that they talk about that, why it's important to have disinfectable surfaces that are not porous and not full of little scratches and cracks and things like that. Prevention: wash your hands. People, aren't you tired of us public health people saying that? But it really is the most effective way to prevent human cases. Again, we're not going to eliminate the source, but we can prevent the cases by managing those types of contacts and through vigilant hand washing, right? When do we wash our hands? That's something people don't usually talk about, right? So before you eat, drink, smoke, do contacts, mess with your makeup, anything to your face, you want to wash your hands. You know you have a gross job when you want to wash your hands before you go to the bathroom. But that's true too, right? Some of us do that. Do it before and after. After you remove gloves, a lot of people don't do this. You put the gloves on, they think that it's done its job, now we can take them off, but you often cross-contaminate your hands removing your gloves, and especially removing booties. And we did some cultures, and it was amazing how much more contamination there was of hands when we used booties versus when we didn't use booties. Now, there's a lot of good reasons to use booties, but you want to wash your hands afterwards, right? And if you're picking up stool, absolutely, even if you wear gloves, especially if you don't. I'm gonna tell you this story. I probably shouldn't, but I'm going to. So I led the outreach program at Ohio State, where we provided basic wellness care to pets owned by homebound seniors and income screened folks in our community. And I went to this one house with our vet students, and the guy met us at the door, and I shook his hand. It's great to meet you. And we walked in, and we walked past his litter boxes because he had a lot of cats. And he goes, "Oh, I missed one." And he reached in and scooped up the, and I was like, "Oh, okay." Yes, let's get the alcohol gel out. All right. So some of you may be familiar with this. Actually, there was a series of salmonella outbreaks associated with veterinary clinics and with shelters. And this MMWR highlighted several of them, but I wanted to point out a couple things from this 1999 outbreak in Washington. And again, there were several very similar cases, but they had human cases. One of them was a clinic employee, so always those of us working there and with the animals are at highest risk. Two of them had brought their cats to the clinic for a non-diarrheal illness. The cats developed diarrhea after discharge, and then the people in the family became ill from the cats. So salmonella is kind of there's a lot of secondary cases. And sometimes you'll have non-clinical shedders, and then their contacts will get sick, and so you might lose the trail when you're tracing those back. So it does spread very quickly and very rapidly, right? So they were able to establish that as a definitive link with pulse field gel electrophoresis. A few years later, a shelter in Idaho had an outbreak that sickened, let me see, I don't remember the number, 49 people, and 10 of them were hospitalized. So a few cases were confirmed. The health departments always investigate these clusters when they come up, and they do interviews, and they found that the shelter was a common source that all of them had visited. So they reached out to the shelter, and they were getting a lot of cases coming in rapid succession, so they reached out to CDC as well. So CDC came down and helped with this investigation. They sampled at the shelter, and they found a match to the human cases from the shelter, specifically from cats in the shelter that were culture positive. They also cultured cats that had been adopted from the shelter and found many of them to be culture positive as well. Environmental samples were widely contaminated from all over the shelter. Places that you wouldn't even think would be exposed were exposed, just again showing how we move that bacteria around on fomites and on our hands to new places. One of the cases was a child who had visited the shelter but didn't adopt. So again, important to know who's there, but also important to remember that it's not always the duration of contact, right? That certainly increases our risk, but even casual contacts can result in that. Fortunately, there were no fatalities. There generally is a 1% fatality rate, so they were very lucky. I think the community response would have been very different had the shelter had a fatality associated with this outbreak. And they worked very closely with the health department. They worked very well with the media, updating people on what they were doing and in identifying people who might have been exposed or adopted recently through those methods. In tracing back to try and identify what the potential source was, of course they're not able to definitively know that, but they had a recent hoarding case that they had brought in a large group of cats and processed them, moved them up for adoption. They think that might have been the source. It could have been introduced by an infected person. Remember, zoonotic diseases go both ways. And the first human case was a kitty cuddler at the shelter. So they're thinking it's possible that it might have gone that way. Looking at the timing, and I'll share a little bit more information later, that's less likely, at least for it to have been that person, but it could have been a different person. It could be contaminated food. This particular salmonella was a multi-drug resistant salmonella, one oftenly found in people, and so probably wasn't the food as a primary source, but it's certainly possible. So what happened, the shelter shut down for 3 weeks so that they could manage this outbreak and clean, and they followed all of the typical recommendations that you hear for outbreaks: identify the sick, isolate the sick, cleaning and disinfection, and they cleaned and sampled, and it was still contaminated, and cleaned again, used steam cleaning, chemical cleaning, they painted the walls. They did a lot of work, and when they came back and sampled again, they still found a lot less, but they still found contaminated areas. And they felt that that might have been associated with the condition of some of their housing units, which were scratched, polypropylene with scratches and food bowls with teeth marks and things like that. So they chucked it all. And they spent about $20,000 to replace all of that with stainless steel. And they did a lot of other things to help minimize cross-contamination points. And I won't get into all the details. There's some articles out there if you're interested in more about what they did. But they put in more cleaning protocols. They managed animal flow. They managed their population better, developed a zero tolerance for general illness in the population. And this, yeah.
Do you know in that case, I mean, they spent $20,000 replacing cages. How much did they spend in diagnostics? Do you know in that particular case?
So the question was, how much did they spend on diagnostics? I don't know the answer to that, but I do know, and this is not always the case, but I do know that the health department paid for those diagnostics because they required them to be done. They don't have to pay for it, but in those situations where they require it to be done, they usually do. I mean, it's not like it was a really iron fist kind of a thing. The shelter definitely wanted to get to the bottom of it. I would say you're easily another 20,000 based on the number of samples. Right, right, you can't. And so then you need to really look at a lot of some of your options. One thing I would add, because this came up, was should we test all the cats in the shelter? And the answer is, well, there's not a right or wrong answer, but my answer is no, that we don't need to test all of the cats in the shelter. So we separated the clinical cats and they tested those and treated accordingly. But testing all of the cats in the shelter, a negative doesn't mean that they're not shedding. It means that you didn't get any virus in your sample, right? And if they're shedding intermittently, that's not going to be very helpful. If they're on antibiotics for something, you're probably not going to get a positive culture, even if they are shedding intermittently. So there's a lot of reasons where a negative is not necessarily a guarantee of a lack of infection. If you remember from vet school with horses even, you do 3 serial cultures before you say they're negative, that kind of thing. It's just not feasible. Yeah?
What proportion of them will have bloody diarrhea? Like how reliable is that as a clinical sign?
I wouldn't, so the question is how reliable is bloody diarrhea as a clinical indicator of salmonella? It's not pathognomonic for salmonella. Not all cases have it, and I would say that even most cases don't have it. I'd say most cases have no clinical signs to mild diarrhea. Sometimes you'll have bloody diarrhea. And there's a lot of other things that also can cause bloody diarrhea. So it's just something that we note, but it's not something that I base a treatment decision on. Does that make sense? Yeah. Yes, so will hand sanitizer adequately kill salmonella? Yes, it will, provided your hands are clean. There's always a caveat, right? So if your hands are visibly soiled, or if you're like rub them and you get that like kind of brown oil scrunch, it's not going to penetrate that to kill the salmonella. So you have to have clean hands. Hand washing under running water is the best with soap because it washes away, mechanically removes. In the absence of that, alcohol gel is an adequate substitute as long as you know its limitations, right? But it will kill the salmonella. Excellent. So with this outbreak, in the heat of it, when they said, are you seeing more diarrhea in the cats? What else is going on with your population? The vets reported that they weren't noticing more diarrhea in the cats. And many cats were noted to be sick with upper respiratory infection, and they were all being treated in the general population. After everything was over, and they went back and took a look at their records, they actually found that there was an increase in diarrhea in cats starting 2 to 4 weeks before their first human case. So I thought that was a really important finding. Sometimes our general perception in a busy environment is not going to pick up more subtle changes that are important. But when they looked at their records, they saw, yeah, we actually do. We are treating more cats for diarrhea. We're seeing more diarrhea. And they also calculated that nearly 80% of their cats were currently on antibiotics or had just finished a course of antibiotics for upper respiratory infection or other issues. That is a lot of antibiotics, and I think was definitely a contributor to the spread of salmonella in this population, right? And they also mentioned that because they started isolating all of their sick cats, so they actually had them all together and they were able to monitor. And the diarrhea that they saw in those cases that were clinical was intermittent. So it would be like a little bit of diarrhea in a day or two, they'd be fine, a little bit of diarrhea. And about 20% of them experienced vomiting as well, just to share that with you. So the shelter reopened to the public with a lot of restrictions. They had mandatory observation of cat interactions, and they required hand washing and gloves and things like that. And I know a lot of shelters are concerned about making efforts to prevent zoonotic diseases and bringing awareness that it will drive people away, scare people away. But they said that their adoptions did not decrease as a result of all these things. And they've since relaxed quite a little bit. There was a bit of a knee-jerk response to be very, very vigilant, as 49 cases of salmonella would warrant. So they've kind of backed off on that. But overall, they said that visitors didn't decrease, adoptions didn't decrease, euthanasia did not increase, and they had, based on their changes, a healthier population of cats overall. So risk factors associated with humans, I think I've touched on most of these. One thing I do want to point out is that primary cases can occur weeks or months later, weeks or months even after adoption, because those animals can shed for a long period of time and then the person can become ill. So it's not necessarily something you're only going to see in the first week or two after adoption. And secondary cases are very, very common. Chickens and reptiles, those of you who are handling those and adopting those, make sure that your staff are well versed in how to prevent transmission and are wearing appropriate PPE. And your adopters should also have some good information to help prevent that. We can't eliminate the salmonella from these species, but we can prevent transmission to people. And there's a lot of educational resources that you can use, that you can hand out, that are available free online through CDC and other sources. So antibiotics, just to kick that one again, judicious use of antibiotics, so important. Isolation of sick animals. Vigilant disinfection of litter boxes and contact surfaces. If you're experiencing diarrheal issues, you may want to switch to disposable, at least temporarily, till you get everything under control, and then go back to your regular sources. But make sure that you're disinfecting those appropriately and that they're in good condition. The plastics that get scratches in them, that can harbor, especially remember those biofilms I mentioned, that can harbor the bacteria and protect it. Yeah?
So do you think that giving cats cortisone rather than antibiotics will help prevent some salmonella cases?
So you're asking if using Fortiflora or a probiotic can help prevent salmonella if they're on antibiotics. We don't have any studies that have looked at that, but it makes clinical sense that it would, and certainly that's kind of a supportive care that's been provided in Salmonella and Campylobacter and similar cases of diarrhea where everything's just kind of getting washed out. So it won't hurt, might help. How's that? Yeah.
So you're saying do or don't use antibiotics?
So I'm saying don't use antibiotics unless you absolutely have to. So are you talking about treatment of salmonella, or are you talking about in general?
Well, I use acupuncture completely on my URI cats.
Uh-huh.
And it works beautifully. And I notice that the ones that tend to get antibiotics and the relief vets are in tend to get sick.
Mm-hmm.
So I was just making.
Yeah, so judicious use of antibiotics, period. So use the right drug for the right bug. Know it's going to be effective. URI, consider that most of these are viral, and the antibiotics aren't going to be helping. They're just disrupting other things. So use your clinical judgment. Prophylactic antibiotics, not recommended under any circumstances as a preventive measure. Now, when it comes to treating salmonella, most cases don't need treatment with antibiotics either. Supportive care is sufficient. If you're having severe signs, this animal is becoming debilitated, absolutely antibiotics are warranted, and you may want to do sensitivity because there is a lot of multi-drug resistance out there, and you may be using antibiotics that are ineffective. Okay? Yeah, in the back.
When cleaning with feed or hot water, is there a certain temperature or threshold for any time duration of contact for cleaning? You mentioned extremely cold, but not on the hot side.
Mm-hmm. So the question is there a certain temperature threshold or time that you need to maintain that temperature? And I would say there probably is, but I don't know what it is. I do know that when you're cooking eggs, a runny hot yolk can still contain salmonella. So it's going to be somewhat heat resistant. A hard-boiled egg is going to kill it. Boiling water is not easy to come by when you're cleaning. But beyond those two marks, I'm not sure what the magic cutoff is for the heat. I know they used steam cleaning here, which is superheated. And I think that was one of the reasons they used it, was they wanted to get that hot steam in the nooks and crannies. I don't know what those numbers are off the top of my head though, but those are great questions. So brucellosis is an issue. One of the things I wanted to highlight here is that it's reportable in humans in all states, and it's reportable in livestock in all states, and it's reportable in dogs in an increasing number of states. A lot of states are recognizing seeing an increase in B. canis and working to try and manage that. In humans, it's often asymptomatic, just like in dogs. Often asymptomatic, we don't notice it. When there are signs, they're pretty variable. Often a febrile illness, symptoms can come and go, and sometimes a spontaneous recovery. Very similar set of signs between people and animals. Chronic fatigue, which is really difficult to diagnose in dogs, and epididymitis, spondylitis. Okay, and relapses are common even if they're treated appropriately with antibiotics, and mortality is very low but present. So how do we get it? Accidental ingestion, again, contamination of mucous membranes or even abraded skin. And it does require close contact. This is not something that we're going to get walking through an area where dogs used to be. All right? Close contact either with the dogs or with the cultures. So laboratory workers are one of the more commonly people affected by this. There's 1 to 200 human cases of brucellosis in the US every year. And only a small number of those are associated with B. canis. In the literature, there's about 40 cases in the US reported. I want to add to this because we don't know. We know it's underreported, but we don't know how underreported. There are differences between B. canis and the other Brucella species that affect livestock. B. canis is a rough cell, and the tests that they use in humans don't pick up B. canis. So how much of it is that they're not actually even testing for it? But when they do test for it, they are finding it. So they think it's a little more common than we think, but it's still a really low risk. There's not a lot of human cases, and it's overall not the worst disease to have. But we do have increasing, especially more recently when we have better diagnostics and we're looking, inapparent infections among those with occupational exposure to dogs. That's us, right? And then here's a case in New York from a puppy. So what's infectious? What do we need to worry about? Fetus, placenta, fetal membranes, vaginal discharge, 4 to 6 weeks post-birthing, they'll still be shedding a high volume in their vaginal discharge. Semen also, and that's even AI can spread brucellosis. Even after it's been frozen and thawed, it can still spread that. Oops. Urine, saliva, other nasal ocular secretions, feces, milk. There's less shedding in these, but they are considered capable of transmitting infection. And shedding is disease is forever. Shedding is intermittent and can occur intermittently for years. In the early stages, when they're bacteremic, blood transfusion, contaminated syringes, or other equipment can also spread B. canis. But that's only if they're bacteremic. All dogs are susceptible, but how common is this? It really depends on where you look. And we have to be careful too, because sometimes they'll come in and say, oh, there's a lot of B. canis in this colony, let's test them all, and then they'll report a prevalence that's really high because this particular group that had a lot of contact and transmission opportunities has a higher infection rate than others. So it is really, really hard for us to tell. But they did some reporting, some sampling in Brazil. 16 out of 38 kennels they tested had at least one positive dog, and prevalence within a kennel varied from 4% to 63%. And a lot of that has to do with their breeding activities. Studies of dogs in the southern US, stray dogs, I believe, around 8% were seropositive. Right, so we really don't have a great handle worldwide, except for to know that it's variable. But one thing that we've seen in all the places that have tested and then come back a couple years later, or 10 years later in this case, and tested again, is that it's increasing. So we're definitely seeing an increase in Oklahoma in 94. They had a 2% seropositivity rate. In 2004, they came back and kind of repeated the same type of sampling and had a 13%. So it's increasing. We're getting more reports of it from private clinics and from veterinarians in all all areas who are working with dogs. So here's probably one of the reasons why, right? So 15, 20 years ago, pure breeding was the predominant activity for the pet trade. And now there's all these designer breeds. So that one stud that was infected, instead of now a Yorkie stud infecting 3 Yorkie females, they're infecting 3 Yorkie females and 3 Newfoundlands and 27 poodles and whatever. So I think that's one contributor to our spread. And then we also have a lot more movement of dogs. So we have large breeding kennels that are auctioning dogs and trading dogs with other breeding kennels. And then we also have the pet trade, where the breeders, through pet stores and through online sales like this, find your puppy anywhere and we'll ship it to you tomorrow, spreading all across the country. So we're seeing more cases and more spread of Brucella, right? It just blows my mind. And one thing that I find very frustrating, a friend of mine wanted to get a puppy, and the shelters don't have a lot of puppies, and he was looking for a specific type of puppy, and he really wanted a responsible breeder. He had a really difficult time finding one, and he kept sending me, what about this rescue? What about that rescue? And what I found was several of the rescues were actually dog brokers, and they were purchasing puppies and then selling them, but they were pretending that they were rescues and that they were saving them from the breeders, which I found very frustrating, to be part of the trade, to do that. So just an aside. There was an outbreak in Michigan between 2007 and 2010 that was recently reported in the literature, 153 dogs in 9 commercial kennels, and 10 privately owned pet dogs, right? We have to remember the ultimate source or the ultimate destination is in people's homes. And so if we're moving positive dogs, they're moving into people's homes. Source, yay, my proudest moment, Ohio and Indiana movement, and stud services between kennels. Prevalence in those kennels, they tested 7% to 84%. Again, highest where they have a lot of crossbreeding going on, and poorer biosecurity and quarantine protocols for incoming dogs. 5 pets with no known association with infected kennels were also diagnosed in that outbreak. And this is a rescue that had a couple B. canis dogs that it brought in. And the health department shut them down. Actually, I think it was agriculture, that shut them down because they had regulatory authority over Brucella canis in dogs for a period of time. I think they were closed for 115 days while they did serial testing of the rest of their exposed dogs to make sure that they didn't develop B. canis. So just a cautionary tale, we can get this in our shelters. Right, it can come in. So how do we do that? Some shelters and rescues are going to the auctions and buying the breeding dogs to rescue them from that life. Some of the breeders will surrender to shelters dogs that they're done breeding that either aren't, maybe have fertility problems or have just had multiple litters and they're done with them. Cruelty and neglect cases. We might bring in hoarding cases. There was a hoarding case in Washington State where the dogs had Brucella canis, and the people were also, I believe, seropositive, at least one of them. And owner surrenders. People are buying these dogs as pets, and they may or may not know that there's a problem, surrender them to shelters. So this is something that I think as shelter vets we need to be aware of. We need to look for. When you're doing your spays and neuters, pay attention to strange-looking testicles. Maybe test that dog and find out what's going on. Incubation period in dogs is 2 to 3 weeks. And they are considered infected for life. So this is a real struggle with how to manage these, especially if you're looking at trying to find a new home for an animal that's positive. You can reduce the risk, but you cannot eliminate the risk. And in some states like Ohio, it's illegal to sell them or give them away. So that if you own it and it's positive, you have to keep it or you have to euthanize it. So there are restrictions on movement of those animals in some states, so you need to be very, very aware of that. So they can be bacteremic for 6 months to 5 years with actually organisms in their blood, and that can be intermittent as well. But generally, they're bacteremic for at least 6 months. And then they persist in bone marrow, lymph node, spleen, and the prostate, and then can come back out on occasion, causing bacteremia again. In females, infertility, and late-term abortion, stillbirths, Vaginal discharge that's persistent are signs that you may see. In the males, abnormal sperm infertility, epididymitis, orchitis, things like that. And sometimes several cases that we've seen at Ohio State were, per the owners, non-clinical, but they came in for back pain and were diagnosing spondylitis and then testing and finding them to be positive for B. canis. So sometimes that's the only sign that you'll see. Stiffness and back pain. All right. So we can diagnose this reliably between 1 and 4 weeks post-infection. So that's very helpful when you have a known exposure and you're testing to make sure that they didn't get it. But testing is complicated by the lack of an ideal test, right? Don't we wish we had that for all of them? But this one is particularly challenging. There's a lot of tests out there. Some are more sensitive, meaning that you can have a higher reliance on the negative results. Some are more specific, which means you can place higher reliance on the positive results, but the negatives might be positive. So you kind of need to balance those tests. Most people are using the rapid slide agglutination test. One reason is because you can do it in your office. It's a card test. And another reason is because it is one of the higher sensitivities among the tests available. So if it's a negative, you can be reasonably confident that if there aren't clinical signs and you have a negative test, that it's actually a negative animal. So that's often used as the first line screening test. All positives, though, should be confirmed. And again, multiple tests out there, no perfect test. Ohio Department of Agriculture is using a tube agglutination test. Culture is really reliable in early infections, again, when they're bacteremic, but later shedding is intermittent, so you may miss it. And if they're on antibiotics, you definitely might end up with a negative culture in the face of infection. PCR is out there. Again, this is pretty new, and there's a lot of variation from lab to lab as to how good that test is, so just be aware of that if you're looking at PCR. Right, high variability in all of these tests, actually, among laboratories. And Cornell is one of the most highly rated labs when it comes to Brucella testing. So a lot of people send their tests here. They didn't pay me to say that, by the way. I just sharing that. That's where we recommend that people send theirs. But do know, as this disease is regulated in many states, they may specify which lab and which tests have to be run. So in Ohio, confirmatory testing has to be done at the Department of Agriculture. I can still send stuff to New York if I want, but I also have to send those results to, or send those blood samples to the Department of Agriculture in Ohio. So wherever state you're in, find out what your regulations are. You may be required to do a certain test or to do it at a certain location. All right, so how do we prevent and control this? Fortunately, it's pretty easy to kill with all of our common disinfectants. There's no vaccine for dogs. And neuter and spay, this is recommended for any positive dog that's going to be a pet, because reproductive secretions are the most highly contaminated with material. So that's the most common way of spread. But neutering and spaying will reduce but not eliminate that risk. So we need to remember that other things like urine and feces can still be contagious, and there still are vaginal discharges and things even in spayed animals. So if people are housing positive dogs as pets, they need to have a talk either with a knowledgeable veterinarian or public health professional on what precautions they need to take to prevent the risk of infection. And if you're managing those cases, long-term antibiotics are recommended, months, and typically a multi-therapy where you're using 2 different antibiotics at the same time to try and knock that back, knowing that it still may remain in hard-to-reach places like prostates and bone marrows. Typically, if they respond to that, and they'll become test negative on all of your tests, but still be harboring that bacteria, you'll want to monitor with serologic testing about every 6 months to see if they're going to recrudesce. So PPE with your suspect or confirmed positive dogs, PPE during and following whelping. So if you've got foster parents who are having the puppies, or if they're being born in your clinic, sometimes that veterinary hospital, sometimes that happens, wear PPE. If you're doing a C-section, wear PPE when you're handling these puppies. Okay. And laboratory workers, for some reason, they sniff culture plates. It seems wrong, but it happens a lot. Like, smells like E. coli. I don't know what they're doing, but I don't know. I smell dog ears, so maybe it's the same thing. It smells like yeast. So don't sniff culture plates. So Ohio's a pretty interesting case study. We passed regulatory laws that went into effect in December of 2014, regulating high-volume breeders, requiring that they test for Brucella canis for all of their breeding stock annually at least. So only licensed and accredited veterinarians can draw the blood and run the tests. I think that was an important thing to note. Check your regulations where you are living and working. All test results, negative or positive, from any veterinarian need to be reported. So even if this is just a pet, hey, I wanted to test it, you need to report the negative or the positive. And then again, all the commercial dog breeders are required to do the testing. All right. So what are our results? They tested 10,673 samples in the first year. 151 of those were designated as suspect, so they were positive on their RSAT test. And then 79 of those were confirmed positive on the tubagglutination test, which ended up being a little bit less than 1%. The majority of those, 85% of those samples, were from our licensed high-volume dog breeders. So those that didn't meet that number of dogs per year were still breeding dogs, weren't included in this. And again, about 15% were pet-owned dogs. I will say they knew this was coming. We believe that we had a much higher rate in Ohio. It's kind of a hotbed for dog breeding. And I still believe that. They knew this was coming, and a lot of them eliminated all dogs with any reproductive issues from their kennels before they did the testing. So I think it was a lot higher. But this is what we started with. And then a year later, or 2 years later now, as testing is coming in, we're doing even more tests than we were before. But we had 0 cases in our high-volume breeders. So in a very short period of time, it's pretty much been eradicated from our breeding kennels, from our large breeding kennels. Just this year, they passed a regulation where they lowered the number of dogs needed to be considered a high-volume breeder. So hopefully we're hoping to catch a lot of those smaller breeders and do the same with those. So make sure you know what the regulations are in your state. Consider screening dogs in the shelter if they come from high-risk sources. So if you know they're coming from a breeding situation, if they have clinical signs, maybe your pregnant dogs, if you're going to let them whelp, go ahead, or even if you don't let them whelp, go ahead and test them. That would be a good high-risk group to test, and wear PPE. There's a lot of great resources available out there for you. USDA has put together a resource for kennels, and then the National Association of State Public Health Veterinarians also. And these are both available for free online. So I want to cover Campy really quickly. There's a lot of similarity with Salmonella, so I don't want to cover the same ground, but foodborne disease, poultry, livestock. It causes enteritis, and in livestock it causes reproductive issues as well. Most cases in people are Campy jejuni, about 90%. They also see coli and Upsaliensis. Interesting that Upsaliensis is now the most common one found in dogs and cats in the United States, and then jejuni also. Like Salmonella, low infectious dose. Signs develop a little bit longer time period, 2 to 5 days, lasting about a week. Similar clinical signs. One thing, they don't get the reactive arthritis, but Guillain-Barré syndrome is known to be associated with people recovered from Campylobacter. This is out there, just like Salmonella is out there, right? We just need to assume it's there. 33% of raw chicken samples test positive. Some poultry flocks are 100% effective. I don't know where the 0% flocks live, because we have not found that. Even the baby chicks that get shipped all over the place, they all have Salmonella. 19 to 37% of cattle, 5 to 76% of dogs and cats. And again, a lot of these are healthy. So it doesn't necessarily mean that it's causing illness. So just because we find it doesn't mean it's causing illness. Right? All right, I don't want to get into all of this. Upsaliensis is the most common one. So dark field microscopy is one of the diagnostic tools that we have. You can see the darting movement of Campy. A lot of people use gram stain. You see the seagulls. That's a great screening tool, but we need to not consider that as confirmation because there are other bacteria that can look like that. So it's a good screening tool. It is not a diagnostic, a confirmatory diagnostic. The ELISA tests that are out there are not worth paying for. And PCRs are gaining popularity. Again, this is another one that's on the diarrhea panel, and I would have the same comments about that. But I will say, as the PCRs are gaining popularity, that means that we don't have the cultures available to do additional work with. So we can't compare them to other cultures from other sources to see if those were related or a source and a contact. And we can't do antimicrobial susceptibility testing. So cultures still have great value, and it's still the gold standard, but it's very, very hard to grow. So sample handling is critical. It has to be kept at an appropriate temperature, and you need enriched transport media to keep it alive. And when we sampled in Ohio, we got them to our testing laboratory within 2 days. I mean, we actually hand delivered them so that they were there same day or the next day, because it's that fragile. One thing I want to add about enrichment, transport media, excuse me, is that there are several different kinds, and they select for different types of Campy. So some broths, if you have all three of them in there, E. coli might be the only, or Campy coli might be the only one that replicates. So you can select against what you have accidentally based on the broth that you're using. And it's not really well understood yet what some of those differences are. This is something that we learned sampling during the Petland outbreak that we recently experienced here in the US. Like Salmonella, most cases are self-limiting and don't require antibiotics, supportive care, probiotics if you're so inclined. The most commonly effective antibiotics are macrolides or fluoroquinolone. However, we are seeing resistance to those as well. So if you have failure to respond to treatment, don't assume that you have a misdiagnosis. It may be a multi-drug resistant. So sensitivity, culture and sensitivity is recommended for sure, especially if your empiric choice is not working. So what are the risk factors for animal cases? Intensive housing and commingling. Sound familiar? Stress, especially coupled with overcrowding, antibiotic use, comorbidities like pathogens and parasites and things like that. Raw meat diets, hopefully none of us are using raw meat diets in our shelters, but those are all risk factors for Campy. The good news, it's easy to kill. Doesn't give us the biofilms that Salmonella does. High temperatures, I don't know how high, but the higher temperatures will also kill it, and the alcohol gel is effective against it as well. Same cleaning. I'm not going to give you a cleaning lecture. I'm sure there's one today you can attend. But I will say store and prepare your food away from animals. That was certainly strongly linked to the human cases that came from this pet store outbreak. Are you guys familiar with this? So in 2017, the CDC investigated a multi-state outbreak, including 17 states, of Campylobacter in humans associated with puppies purchased from pet stores. And it became quite an issue when they noted that this was a multi-drug resistant strain of Campylobacter, not just any multi-drug resistance, but it was resistant to all of these antibiotics. 10 of them were also resistant to gentamicin and 2 to fluorphenicol. So some of our bigger guns were not effective against this, and that means when we have severe cases in humans, we don't have good treatment options, and we end up with higher fatality rates. The human samples and the puppy samples were genetically very similar with several matches. This is just a kind of a map to show you where it all was. Look, Ohio, I'm so proud. And Florida, where's my Florida friends? Good job. All right. So it was pretty interesting that Ohio had the year before a cluster that investigated, and they said, it's Campy. Campy's out there. People get Campy, and moved on. There's a lot of Campy cases, most of them foodborne, right? So moved on from that one. And then they noticed at the end of 2016 another cluster of cases with 3 different people from 3 different pet stores. I think 2 of them were employees. And Florida also at the same time was noticing a cluster of cases that they had reached out to CDC about. And then CDC contacted Ohio because Petland is headquartered in Ohio, and they wanted to come and talk with Petland. And Ohio's like, hey, we've got cases too. So this started the larger investigation. And they came to Ohio. This was the final breakdown, 113 human cases, 23 hospitalizations in 17 states. 22% of them were people who worked at Petland. 99% reported contact with a puppy during the week prior to onset of illness. 87% contact with puppy from Petland stores or a person who had become ill, again, secondary cases. Right? And a couple of them that had purchased their puppies directly from the breeder or a broker. So when Ohio followed up to see if they could get the cultures to do additional testing, the labs said we did PCRs, we don't have cultures. And so we really didn't have those to follow up. As new cases came in, they had sent an alert out to the doctors and asked them to get cultures if they suspected it. So we did get some cultures. And one of our human cases, or in the meantime, we did some puppy sampling. One of our puppy cases matched a human case in Florida. So we knew this was definitely a common source outbreak as a result of that. So one of the things that they did in Ohio was find some funding, which is in short supply, and they tested a bunch of puppies. A couple other states did some testing as well. So these 5 states did 102 samples from 13 stores. 8 had the outbreak strain, and there were 15 positives. And what we found in other states and in Ohio was a lot of other campies. We had a lot of them, not just the outbreak strain, which I thought was very interesting. So it seems like we're developing some of these multi-drug resistant strains from multiple sources and then bringing them together and mixing them all up. Right? So that's exactly what we saw in Ohio as well, where they tested puppies from 16 stores. They also looked at the records that were available. I have to say that they were pretty poor records as records go. But 141 puppy records, only 5% of them had not received antibiotics during their pet store stay. 5%. The majority of them, and I mean well over 50%, received prophylactic antibiotics. Healthy puppies receiving preventive antibiotics. And around 40% had received them for treatment and for prophylaxis. And again, only 5% that didn't have any. And a couple of the pet stores, their protocol was to nebulize gentamicin into the puppy rooms, just in general. Into the whole room, yeah. That was the bedtime thing, I guess. So the majority of puppies also received prophylactic antibiotics at their distributor, at the broker. So the broker would buy them from the breeders, bring them all together, give them all antibiotics, and then transport them onto the pet stores where they got more antibiotics. This is exactly like what you should never do. This is the perfect storm, right? We're stressing them, we're bringing them all together, we're giving them all lots of different antibiotics. And I would say 10 different antibiotic classes were in use. This was not like everybody got Clavamox. They would try one and then another and another. And in different locations, they got different antibiotics based on what the favorites were there. 10 different classes were in use. And some of these dogs received, many of them, multiple antibiotics from multiple classes. So it was really a challenge for our health departments to trace back, right? So a single source breeder was not identified. That was our ideal, like, oh, it's all from one breeder, like the psittacosis outbreak with the parakeets that happened several years ago, and all traced back to one breeder. Not the case. We're really seeing this rising up in several breeders and then magnifying along the transport chain. So we're mingling them in cars, we're mingling them in pet stores, and then it's spreading, it's amplifying, and then we're sending them out into the community. I have no doubt that there are a lot of cases that just never get detected. They get passed off as your typical foodborne campy, or they're never diagnosed at all. So I think this has been happening for a lot longer than we think. We just were able to catch on to this one and follow it through. All right, risk factors that were identified associated with this. Again, the majority, 22%, were staff. No break rooms, so they're preparing and eating food right there with the animals. Inadequate hand washing supplies, even if they had them, they maybe didn't have soap or towels. Cleaning and disinfection protocols were inadequate and exacerbated by a move one down technique. So they weren't cleaning adequately, and then they were moving one down. You guys are familiar with that cleaning technique. So you take this animal, you have an empty cage, you clean this cage, and then you take the next animal and move it into the cage you just cleaned, and then clean that cage, and then move an animal into that cage. So instead of the animal coming out, cleaning, and going right back in the same cage, they're shifting cages. So if you don't have good protocols in place, you're increasing your opportunities for disease transmission that way. Indiscriminate antibiotic use, terrible record keeping, lots of comorbidities, housing, stress. So this is really a cautionary tale for shelters, I think, because there are a lot of shelters that have a lot of things in common with this. Our animals are stressed, they've been shipped, they've come from multiple sources. We may be using antibiotics inappropriately, or they've received them, having received antibiotics inappropriately from other sources. We need to remember that a lot of the dogs are shedding, and there's a higher prevalence among strays, even when they're healthy, right? Just like with salmonella, intensive housing, and opportunity for dissemination in the community. So if we increase the number of cases in our shelter and then send them out through foster homes and adoptions, we can be spreading disease in our communities. All right. So thank you guys very much. I'm sorry I rushed through there at the end.